Start now.
So good afternoon, everybody. Today we are going to discuss on a very common fertility procedure that we do at a fertility center, which is about intrauterine insemination. So in today's discussion, we should understand everything in and about the intrauterine insemination, which is in short, which is called as IUI. So I am Dr. Gayatri Satpathy. I am a fertility consultant and laparoscopic surgeon at Oasis Fertility at Bhubaneswar. So let's begin our discussion. So what is IUI? So intrauterine insemination is most commonly referred to as an IUI procedure. IUI is nothing but a short form for intrauterine insemination. So it is a fertility treatment. It's the most basic and simplest level of fertility treatment, which is also known as artificial insemination. So here the partner's sperms are directly placed inside the woman's uterus in order to achieve a pregnancy. So before we go into intrauterine insemination and understand what is being done in IUI, let us first understand a basic about natural conception. So when a couple is trying to get pregnant naturally, and so during a natural intercourse, the semen gets deposited in the vagina. So when the semen gets deposited in the vagina, a normal semen should contain more than 20 to 30 millions of sperm. So out of these millions of sperm, there are few thousands of sperm which are actually able to reach the uterine cavity. And from there, the sperms have to further travel and go and reach the fallopian tubes. So few hundreds are actually able to reach the fallopian tubes. And at the same time, when around the time of ovulation, the egg which gets released from the ovary also gets inside the fallopian tube. So it is inside the fallopian tube that the sperm and egg meets and fertilization happens. So the hundreds of sperms which have actually been able to reach the fallopian tube. So out of these 100, there's only one lucky sperm, the sperm which was able to compete among the all of these sperms. So that particular sperm is actually able to touch the egg membrane, and once it touches, it's able to penetrate inside the egg. The egg does not further allow any other sperm to enter inside. The sperm and egg fuse, and the fertilization happens, and from there the journey of formation of the embryo and the pregnancy starts. So let us now understand what we are doing actually in an IUI and how different it is from a natural conception. So as we understood, in a natural conception, the millions of sperms are actually deposited in the vagina, and from there they are slowly ascending up, and the number of the sperms are actually decreasing. So when a man has got a very good semen parameters, so even if the number of sperms are decreasing as the sperms ascend or as the sperms travel from the vagina to the uterus to the fallopian tube, so it's able to compensate. However, in IUI, what we do is normally if a man has got a lesser amount of sperms or the motility is less, so we prepare the semen sample in such a way that the healthy and motile sperms in a concentrated amount, that is millions of sperms, are directly placed inside the uterus of the woman. So the advantage is that more amount of motile means the sperms which are able to move very well. So motile sperms and healthy sperms in a larger quantity are placed directly inside the uterus of the woman. And secondly, the distance the sperms have to travel from the vagina to the uterus, so that distance is now saved. So the time is saved, and the distance which the travel is also saved. And so now the sperms have to travel only a short distance from the uterus to the fallopian tubes, and already we have placed a large amount of sperms inside the uterus. So the probability that, in comparison to a natural conceiving way, the probability slightly increases by 5 to 10% when we are doing an IUI. And so it is only the sperms that are placed. However, other things have to happen naturally. That is, the ovulation must happen naturally. The egg must get inside the fallopian tube, and the fallopian tubes must be open, and for IUI to have a good success. So, who all can benefit from IUI? So, most of the women who walk into our fertility chamber, so most of the times the first line fertility treatment that is being offered is an IUI. However, there are certain group of women whom it actually benefits more. So, who are these couples? One is if there is a mild male factor infertility. That is, if they have just a suboptimal semen abnormality, That is, at least if the sperm count is more than 10 million, or that if the motility is at least more than 20%. So these are the couples who will actually benefit from an IUI procedure. The second is when there is a cervical factor. That is those women who have got a hostile cervical mucus. So hostile means it is not favorable for the sperms to cross through it. So if these women have very thick mucus, or if the sperms are getting trapped inside the cervical mucus, so in IUI, how does it help? We are able to, because we are directly introducing inside the uterus, so this cervical factor can be easily overcome. The third, where IUI gives the maximum benefit, is in couples who have coital issues. That is where they have sexual dysfunction. So if the man has erectile dysfunction, or he has ejaculatory dysfunction, or if the woman is suffering from female sexual dysfunction, for example, if she has vaginismus, or she has dyspareunia where she is not allowing the penetration to happen. So in such situations, IUI can be of great benefit to the couple. The fourth situation is if there are any immunological factor. For example, if the vagina or the cervix has certain antibodies against the sperms, and because of which it is destroying the sperm, so big IUI can overcome these factors. And then another group is women who have suffering from mild endometriosis, or grade 1 or grade 2 endometriosis. So in these women, it is advised that ovulation induction should be done. That is, medicines should be given so that her ovaries produce eggs, and an IUI done simultaneously, so that it provides a maximum benefit in comparison to trying naturally. And then there are a group of women who have ovulatory dysfunction. For example, if the woman has PCOS, or woman is obese, they are not ovulating on time. So giving them medicines for ovulation to happen, and timing the ovulation with an IUI is of great benefit to these couples. Then the use of donor sperms in IUI. So there are certain men who have very severe semen abnormalities, and or they do not have any sperm in the ejaculate, for which they require an IVF. However, the couple is not able to afford for an IVF. So in these situations, IUI can be of great benefit, where the semen can be taken from a donor, and this is taken from a donor bank, and the semen is then introduced inside the woman's uterus and increases her chances of getting pregnant. Then there is a certain group of women, couple, who fall into the category of unexplained infertility, where all the factors are normal. She's ovulating well, her fallopian tubes are normal, semen parameters are normal, but she's not getting pregnant. In such a situation, giving medicines for ovulation and timing the ovulation with an IUI greatly increases the chances of pregnancy. Then this particular scenario, where either of the couple have viral infections, such as they are suffering from HIV or hepatitis B infection. So these infections can also get transferred to the other partner because of sexual contact. So when we do an IUI, the semen is processed, or it is cleaned up, so that the viral load, that is a number of virus which is present in the semen, gets reduced to a large extent. And when this processed semen, or when this cleaned semen is introduced inside the woman's uterus, the chances of transferring the infection from the man to the woman is reduced to a maximum. And also, in case even if the woman is positive with HIV or HPSAG, and even she can transfer the virus to the male partner because of the natural intercourse. So if you're doing an IUI, so you're even preventing the male also to get infected in case the female partner is infected with the viral infection. These are some special circumstances where actually IUI is of great benefit. So when before we allocate IUI as a fertility treatment for a couple, we need to know whether the woman or the couple are the right candidate for the IUI. So for this, we need to do a preparation pre-IUI. So the preparation is just to know if you are the ideal candidate and whether IUI is going to help you or not. So for that, we need to know the ovarian reserve of the woman. So we want a good ovarian reserve. Second, that we want to know regarding the fallopian tubes, whether they are open or not. Why? Because in IUI, we are only introducing sperms inside the uterus. But if the fallopian tubes are blocked, the sperms will not be able to reach the fallopian tube, and the fertilization will not happen. So fallopian tube patency, that is whether it is opened or not, needs to be assessed before we do an IUI. The third is we need to understand if the semen parameters are normal, or at least if they are suboptimal, or at least they are in a range where the IUI is possible. So we are semen analysis is very important, and also we we have to check the age of the woman. If so, preferably it is preferable to do an IUI if she is within 36 years. It's not that we do not do an IUI when somebody is more than 36 years, but then because the chances are less, we do in these women, but then we prefer doing IUI in women who are less than 36 years old. So these are the minimum tests which are required before an IUI, before we label them that they are fit for getting an IUI done, and then proceed with the IUI. So first is we know to know the ovarian reserve. So for this we have blood tests like the AMH test, and then we have ultrasound to know the antral follicular count. To know whether the fallopian tubes are open, there are tubal patency tests which are called as hysterosalpingogram or sonosalpingogram. Then third is the uterine assessment. We need to check whether there is any other anomaly inside the uterus. For example, is there any adenomyosis, or is there any endometrial polyp, or is there any fibroid, before we go ahead with IUI. So this is done through an ultrasound assessment. A transvaginal ultrasound is done. And fourth is to do a male factor assessment. So this is done by doing a semen analysis. So now, once we have labeled that a couple is fit for doing an IUI, so now we proceed with the actual IUI. So now we shall discuss what are the steps of IUI. So the first step of IUI is where we give medicines to the woman so that she can develop eggs within her ovaries. So generally we give them oral tablets. Sometimes injections are given so that the aim is at least one or two follicles grow inside the ovary. So why one or two? Because we do not want multiple pregnancy to happen. Our aim is that there should be a singleton pregnancy or maximum of twin pregnancy. So once the follicles are developed, so follicles are these tiny little bags of water where the egg grows, and we track the size of the follicle. And this tracking, the egg tracking or the follicle tracking, so this is done using an ultrasound. So one or two ultrasounds are done after the medicines have been taken. And once the follicle reaches a good size, we assume that the egg has matured inside, and then the injection is given so that ovulation happens. Once the ovulation happens, the IUI procedure is planned generally between 36 to 40 hours after the injection which has been given for ovulation. So this is how an IUI is done. So on the day the IUI is planned, the sperm preparation is done. So it is not that a man gives a semen and the raw semen is only introduced inside the woman's uterus. No, the semen is cleaned up. It's called as sperm preparation. So the semen sample is layered over a density medium sample, and then it is centrifuged inside a centrifuge machine for a number of rotations. And once the centrifugation is done, the good motile sperms are found in the bottom of the tube. And now these healthy motile sperms are taken up inside a catheter. And it's a very small, fine catheter which is used. It is loaded with the particular semen sample which has been prepared. The woman is made to lie down on the examination table, and with her legs apart, we introduce this small catheter inside the uterus of the woman, and under strict precautions where we take care that there is no infection introduced. Woman is completely stress-free, and she is relaxed. And now the catheter is introduced, and we push the sample inside the woman's uterus. And once this procedure is done, we ask the woman to lie down for 10 to 15 minutes on the table, and then she can go back to her home. So these are very frequently asked questions from the woman or the couple after an IUI is done. So doctor, what can I do or what should I avoid? So these are the do's after an IUI. So first is that you should have regular diet. It is better to avoid outside food or junk food or any processed food during this time. It is better to take simple home cooked food. Second is you need to continue your day-to-day activities. There is absolutely no requirement to take any leave from work, because taking leave from work actually adds to the stress of the woman. So you need to keep yourself happy, fresh. You can do some light exercises. You can continue doing your yoga. You can do meditation, because all these also help to improve the mental health and also improve the blood supply to the pelvis. And so, what are the things we need to avoid after doing an IUI? So, yes, you need to avoid painkillers or any other medications, over-the-counter medications. Always consult your doctor before you take any antibiotic or any kind of medicines post IUI, because some of the medicines are not safe in the first trimester or the early days of pregnancy. And second is we need to avoid stress. Third, you need to maintain a sleep schedule. So disturbed sleep environment you need to avoid. You need to avoid caffeine, and you need to avoid certain foods. For example, you need to avoid processed food. You need to avoid outside food. And sometimes we ask to avoid fish, especially mercury-containing fish and all. You need to avoid lifting heavy objects. That should be avoided. You need to avoid completely drinking, smoking, and also you should avoid skipping the medicines which we have prescribed post your IUI. And you need to avoid strenuous exercises, but mild to moderate exercises like brisk walking or going or doing some light yoga. So those things are allowed. And you need to avoid swimming. So swimming particularly is asked to avoid only to prevent any infections uh, in your vaginal area, so that it doesn't spread up. Again, another very frequently asked question is, Doctor, is IUI treatment painful? So please remember, anesthesia is not required for IUI, and the procedure is not painful. So because it's not painful, we do not use anesthesia, and it's done as an outpatient on an outpatient basis. And the only thing is that you may experience some mild cramp or discomfort while we are doing the procedure, and maybe for a short time after the procedure. And not all women complain. There are very only few women who complain about it. And so the most common problem which we are seeing is some mild cramping or some spotting or some mild bleeding, which and subsides in a day or two. And generally, women do not require any kind of medications also for these kind of problems. Yes, there can be sometimes some possible risk which can be there, which can be of concern after an IUI. For example, one is OHSS, which is the full form is ovarian hyperstimulation syndrome. But this is very rare, especially with IUI. It is rare. It is only seen when multiple follicles have developed and you have taken a lot of injections to stimulate your ovaries. It's very less common because in IUI we aim for one or two follicles. So this does not happen. In case if it happens, the symptoms of OHSS are that you may have severe abdominal pain, you may have nausea, that is feeling of vomiting, or you may have actually vomiting, or there is some fluid inside your tummy. But it's very rare again with IUI. The second risk which can be there is multiple pregnancy. Again, this happens because when we are giving medicine, sometimes more than one follicle develops, and you may develop a twin or triplet pregnancy. The third is there is small risk of ectopic pregnancy. So, what is ectopic pregnancy? It is the pregnancy which develops outside the uterus, most commonly in the fallopian tube. So, IUI as such does not cause ectopic pregnancy. It is only in those women where the fallopian tubes are diseased or they are not in a healthy condition. For example, if a woman has unhealthy fallopian tube because of certain diseases, like if she has hydrosalpinx, or if she has tuberculosis, or if she has endometriosis, then she can develop ectopic pregnancy. But then these women can also develop ectopic pregnancy after trying naturally. So it is not IUI which is causing ectopic pregnancy. It is the tubal condition in the woman which is predisposing her to have an ectopic pregnancy after IUI. And the fourth risk is infection. Again, it is very uncommon because we are taking all standard precautions of cleaning and using all aseptic precautions are being taken. So less likely that a woman can develop infections following an IUI. Now, once the IUI is done, so when do you do the pregnancy test? So it's 14 days after IUI that you can do a simple urine pregnancy test at home and check for the pregnancy. So, what is the success rate of IUI? So, again, the IUI does not have a uniform success rate because the success rate of an IUI varies from couple to couple based on what is the age of the woman, what is the semen abnormality, any other risk factors present in the woman, etc. So, the younger the woman, the more chances that she can get pregnant with an IUI. For example, in this graph, you can see the women who are between 21 to 25 years, so they are having a pregnancy rate of around 25%. And once the age now, when you see the 26 to 30 years age group, so again, they have a pregnancy rate of somewhere between 18 to 20%. So these keeps decreasing. And more than 40 years, the pregnancy rates are around 5%. So because there are a number of factors which are actually affecting the IUI success. So age of the woman is one of the factor. The higher the age, the success rate decreases. The second factor is what is the duration of infertility. Again, it is seen that a longer duration of infertility, say more than 5 years, 7 years. Again, in these women, although we can do an IUI, but what we have seen is that the success rates are lower. The third is the semen parameters. If the sperm count or motility is very low, for example, if somebody has a sperm count of around 5 million per ml and very low motility, so then the chances of success are again reduced. And if a woman has other factors which are causing infertility, for example, if she has a fibroid in her uterus, or if she has a pelvic endometriosis, which is of grade 3 or grade 4, or if she has hydrosalpinx or any other health conditions which is hampering her in for fertility, then IUI success also can get affected. So because IUI has a success rate of somewhere between 18 to 20%, so it is not that we do only one IUI cycle and then label a woman as IUI negative. It is only when we do a couple of IUI cycles, we tell a woman that you are not able to conceive with IUI. So if a woman is less than 35 years, it is advised, it can be even up to 6 cycles of IUI can be tried before we label them as that there's something not working, there's something else, some other factor which is not allowing the pregnancy to happen through IUI, and then we counsel them to go for an IVF. However, if the woman is more than 35 years, to save time, because at this age, every month is important for them because every month they're losing some follicles and eggs. So after 35, maybe not more than 3 cycles of IUI is what we advise, and if failed, then we go for an IVF. So how much does an intrauterine insemination cost? So IUI is a much cheaper procedure and it's less expensive in comparison to an IVF. At our center, it costs around 7,500, and most of the centers, the cost is somewhere between 8,000 to 10,000. Again, the cost of IUI also varies from city to city and from center to center. So, having known after knowing so many things about IUI, so in short, let me just summarize to you the benefits of IUI. So, the number one benefit is that it is less invasive. So, most of the times it's oral medications which are given, and 1 or 2 doses of injections is all that is required. Second, it is less expensive. The procedure of IUI as well as the medications are much less expensive in comparison to the cost of IVF. And third is again less stress. Woman does not require any frequent visits, maximum 1 or 2 visits to the hospital. And even on the same day of IUI, they get the IUI done and then they can go back to the office. So absolutely no break from the office required. And then it's painless and it does not require general anesthesia. So these are some of the multiple benefits of IUI. So now if we compare IUI versus IVF, in IVF is a technically difficult procedure. So basically, what we are doing in IVF is that the woman's eggs are taken out from her body, and the eggs and sperms are fertilized outside her body. So whatever is happening naturally in an IUI, inside the fallopian tube. So those things are happening outside in an IVF. So in the IVF lab, the egg and sperms are fused and the embryos are formed, and the embryos are now placed inside the woman's uterus. So it's a much advanced level of treatment. So the benefit of IUI in comparison to IVF is that it is less invasive and it is less stressful, and it is less costly. But the benefit of IVF in comparison to IUI is that it has a very good higher pregnancy rates in comparison to an IVF. And then there are certain conditions where a woman has very limited chances with IUI, so then it is better to proceed directly with IVF. If you see IUI versus IVF success rates, even IVF success rates go down as the woman's age increases. So even in younger age group, like suppose a woman is less than 35 years, IVF success rates are somewhere between 50 to 70%, and IUI has a success rate of 10 to 15% only. And as the age advances, IUI success rates also come down and IVF success rates also come down. So how to decide whether IUI is the best treatment for you or IVF is the best treatment for you? So this decision is taken by the couple in consultation with the fertility specialist, because many a times even fertility specialists can guide you well, because there are certain points which you may not be able to know yourself, or you need clarity of thoughts in some matters. So a joint decision is taken between a couple and the doctor to come to a final conclusion whether we are going ahead with an IUI or we are going ahead with an IVF. So the various factors that we look into before we take a decision is, first is what is the duration of infertility. So if it's a very long duration, so if it's more than 5 or 7 years, maybe we'll be more inclined towards going for an IVF. Second is what is the age of both the partners. Again, maternal age more than 35 years or father's age more than 40 years, it is better to go for an IVF. Then what is the cause of infertility? So there are certain situations where IVF is more better in comparison to an IUI. For example, if a woman has got grade 3 or grade 4 endometriosis, or if she has a tubal block where the tubal block could not be opened laparoscopically, or if the man has got very compromised semen parameters. So there are certain situations where IUI is not going to help you. So then it is better to go for an IVF decision. Then again, we also look into what was the type of previous treatment taken by the couple elsewhere before they have come to us, or if they have already taken any IUI treatment. So if a couple has already taken 3 to 6 cycles of IUI, so then it is better now to go for the next level of treatment, which is IVF. So, and also we look into the semen parameters. If the count is very bad or the motility is not at all good, so then it is a wise decision to go for an IVF. And the fallopian tube status. So fallopian tubes need to be open and it should be checked before we go for an IUI. If the tubes are blocked, it is better to confirm it with a laparoscopy and try to open it also laparoscopically. And in case the tubal blockage is to a greater extent and that it could not be reversed with the use of laparoscopic techniques, then it is better to go for an IVF. And then there are certain situations or certain couples who require a genetic testing of the embryos. So who are these couples? One, where the mother's age is more than 35 years, or if there is any family history of any particular genetic diseases running in the family. So these couples will actually benefit from the genetic testing of the embryo and then placing only those embryos which are genetically labeled as healthy. By this, they can reduce the chances of miscarriage and they can reduce the chances that a defective baby is born with so and so genetic disorder. With IUI, we do not have this advantage because in IUI, it is not in our hands what type of embryo is going to form. But in IVF, because all the embryos are formed inside the lab, so we are individually able to check the embryos and then only place those embryos which are genetically healthy. So in those situations where the genetic testing is required, it is the IVF which is the best option for the couple. So the discussion is always done with a fertility specialist, and the fertility specialist is the best person to guide you. Ultimately, it is a couple's decision whether they need to go for an IUI or an IVF. Any particular fertility treatment you are going, you need to understand what the problem is, what is the actual problem, why the doctor is prescribing you so and so treatment. Always trust the doctor, trust the process, and so that it can help you in achieving the pregnancy. I thank you so much for your kind attention, and I am free to answer any questions if there by the audience. Thank you so much. Yeah, so if there are any questions, so that can be displayed, so we can have a discussion on the questions which have been raised. So the first question which has been asked is what precautions are to be taken after IUI treatment. So I think I have labeled the precautions in during my discussion. So few things that you need to avoid is the foremost is that you need to avoid the mental stress. Some amount of anxiety and stress is common when you have taken any kind of fertility treatment, but avoiding excess stress is better. You don't have to keep on discussing about what happened and what is going to happen day in and day out with your partner, and you don't have to leave your job or leave your or take leave. You can go to your office, and certain things like you need to avoid heavy exercises, and you need to avoid straining in the toilet. You need to avoid drinking, smoking, and need to avoid outside food. just maintain a healthy lifestyle is all that is required, and with less of mental stress. So Swagatika Das has asked us, after taking letrozole, why periods are not coming on regular days. So Swagatika, letrozole tablets are not given to regularize your periods. It's a medication which is given to develop the eggs inside your ovaries. If you're not getting regular periods, there are other medications. Most commonly, we give progesterone medications for your periods to come regularly. So irregular periods are generally because of certain underlying health issues. For example, if you have PCOS, or if you have thyroid disorders, or if your weight is on the overweight or the obese side, so you may have irregular periods. So irregular periods also come with a problem that the eggs do not develop. So to develop eggs, we give letrozole. So just because you have taken letrozole, that does not mean that you will get regular periods. If along with letrozole, your doctor has prescribed you medications, that is the progesterone medications to support your pregnancy in the later half of your cycle. So once you stop those medications, you will get your regular periods. So how do I deal with failed IUI? Yeah, so this is very important question, because many of times I have seen couples getting demotivated just with one failed IUI or two failed IUI. So please understand, IUI has got a maximum success rate of around 15 to 20% only. Because in IUI, we are not doing anything different. It's not much different from a natural conception. It's only that sperms have been just placed inside your uterus. However, other things have to happen naturally. The eggs have to come out from the ovaries by themselves. The eggs have to reach the fallopian tubes. And every month, things do not happen perfectly every month also. So, because IUI has a success rate of only 15 to 20% per month, it is only after 3, 4, or 5 failed IUI cycles that we get alarmed. And so, if you are not able to get pregnant with multiple failed IUI cycles, suppose you have underwent 4 to 5 IUI cycles, you're not able to get pregnant. So then the best form of treatment for you is to go for an IVF. So how many times can we go for IUI treatment? Yes. So how many times you can go for IUI treatment also depends upon the, most importantly, depends upon the age of the woman. Because if you are younger, if you are less than 35 years, so from a minimum of 3 to maximum of 6 cycles of IUI you can undergo. And if you are more than 35 years, it is better to go for 2 to 3 IUI cycles, because we also do not want you to waste time. And if in those 2, 3 cycles of IUI you are not able to get pregnant, then it is better to go for an IVF. So I think so. Any other questions you can send in the comment section, and we'd be happy to answer you. So thank you for this lovely discussion today.